Hi, my name is Leah Horton, and my disease project is on cystic fibrosis. Cystic fibrosis is an inherited disease that not only affects functions of the lungs, but the digestive system and other organ systems of the body as well. CF can cause inflammation to the pancreas, infertility, recurring pneumonia, high salt levels in sweat, persistent cough with thick mucus, wheezing, intolerance for exercise, lung infections, stuffy nose, sinusitis, poor weight gain and growth, intestinal blockages, constipation, mucus color change, and a lack of energy. As you can see, these symptoms affect many organs and other organ systems throughout the body. Cystic fibrosis is damaging to the body as a whole. If at risk and showing symptoms, there are two tests that can be performed. One test is a sweat test, which measures the amount of chloride your sweat contains. The second test option is a genetic test in which genes are looked at for chromosomal mutations that associate with CF. Being proactive can save a life. Cystic fibrosis is caused by a defect/mutation in the CFTR gene, which is a protein that regulates the movement of salt in and out of the cell. CFTR means cystic fibrosis transmembrane conductant regulator gene, and it is an integral protein and chloride channel that spans the cell membrane multiple times in specialized epithelial cells. These cells form the lining of the lungs, kidneys, and other tissues that produce mucus. When CFTR fails to perform its function, there is an imbalance in the movement of ions and water in and out of the tissue, and this causes the body to lose its ability to regulate the consistency of mucus. In a person with normally functioning CFTR protein, CFTR transports water and ions in and out of the epithelial cells lining the lungs' air sacs in order to regulate what is being secreted. But a person with abnormal CFTR proteins cannot have the movement of ions and water. Therefore, there is not enough water in the lung secretions, causing a thick mucus to form. This means that bacteria can become trapped in the lungs, causing infections. The type of gene mutation is associated with the severity of the disease, and children need to inherit one copy of the gene from each parent in order to have the disease. Therefore, if only one copy of the gene is given to the individual, that individual will not have cystic fibrosis but will be a carrier. Individuals are at risk to cystic fibrosis only if they are the offspring of two parents that carry abnormal CF genes. One can only have cystic fibrosis if both abnormal genes are passed to the individual by both parents. Even with the gene, there are different levels of severity. CF mutations are divided into classes depending on how much damage the CFTR protein has. Each child born with parents that each carry the cystic fibrosis gene have a 1 in 4 chance in getting cystic fibrosis. In the picture, it shows that there is a 2 in 4 chance that the offspring will be a carrier, as well as a 1 in 4 chance of an offspring that is unaffected. All races and genders are susceptible to cystic fibrosis. However, it is mostly common in Caucasians of Northern Europe descent. In order to diagnose a patient with cystic fibrosis, there are a series of tests that are used to diagnose a patient. First, there is an immunoreactive trypsinogen test, which is a standard newborn screening test that checks for abnormal levels of the protein called IRT in the blood. Second, a sputum test or culture is one example of the gooey substance that often comes from your chest is taken to the chest to see if there is an infection in your lungs or airways. Third, a chest X-ray is an imaging test that uses small amounts of radiation to produce pictures of the chest. It can be used to spot abnormalities or diseases of the airways, blood vessels, and it can also show the amount of mucus that lines the lungs. Fourth, a CT scan can allow doctors to see practically anything inside your body. Therefore, if there was a problem with a patient's lungs and shows similarities to CF lungs, then the doctor can diagnose the patient with CF after a series of other tests. Fifth, as mentioned in the first slide, a sweat chloride test measures the amount of chloride there is in the sweat. If a test tests positive for chloride, then this indicates that the patient most likely has cystic fibrosis. Lastly, a pulmonary function test is a test where the patient is sitting, breathing into a mouthpiece that is connected to an instrument called a spirometer. The spirometer records the amount and the rate of air that you breathe in and out over a period of time. If the lungs are not working properly, it can be due to several different diseases